Hello, everyone. I'm Kathy Diaz, and I am a team leader with Homeopathy. And today we're here to talk about colostrum and homeopathy for dental health. These were two big missing pieces of the puzzle for me as I was on a health journey for my family. And so what I'm going to share with you today is a lot of really beneficial information that I think will help you as you are looking at dental health. Before I go to my slide presentation, I just wanted to refer you to some books that have been really helpful to me. The first one I'm going to talk about as we go through the presentation, but this book, Nourishing Traditions by Sally Fallon, was a game changer for me decades ago. We were using way too many medications, and I kind of sarcastically say that my children were on an antibiotic merry-go-round because it just seemed that they were always sick and we were always headed back to the pediatrician, and then they would end up on another round of antibiotics. And so we went round and round and round until I started learning about nutrient-dense foods as a means to health. So Nourishing Traditions was a big game changer for my family. And at the time when my children were young, I homeschooled all four of my children. The only way for me to learn was to learn alongside them because, our days were already full. So in the morning when we would do our breakfast, I would read a few pages from Nourishing Tradition every morning, like a textbook. And that way I was able to learn and they were able to learn. And it really did improve our health as we learned about nutrient dense foods as a means to health. In the PowerPoint presentation, I'll kind of share a little bit more about that story. But just before we get started, two more books that have been very helpful to me in learning about dental health are these two books. This one is called Cure Tooth Decay, Heal and Prevent Cavities with Nutrition by Ramiel Nagel. This one is a book that I read years ago, and I realized that we can remineralize our teeth. Our teeth are, full of cells, and they're part of our bodies. And when we give our bodies what our bodies need, our bodies will always try to move toward healing and toward balance. And so this book was really eye-opening for me because I had thought that once you had problems with your teeth, it was irreversible. And once I read this book, I realized, no, it's not. It's never too late. You can always give your body what it needs to move toward health. And then this book is the first book written by Dr. Anthony Kleinsmith. He is the leading expert in the world on colostrum. He is the owner of the company of the colostrum that I use and endorse, Homeopathy, and he has a whole chapter on colostrum for dental health in this book. And the name of the book is The First Milk Diet. I'll talk a little bit more about him and colostrum as we go along today. So let me go ahead and go to my PowerPoint, and we will work through this information together. All right, and here you see me eating a nice big spoonful of Colostrum6 powder. This is the colostrum that I use daily, and I'll talk more about it as we go along. But our topic for today is homeopathy and colostrum for dental health. I've learned that these two together, homeopathy, which is a system of medicine, food, are a powerful combination, especially when it comes to dental health. Let me tell you a little bit about myself. I am an educator and not a healthcare professional. These statements have not been evaluated by the Food and Drug Administration and are not intended to diagnose, treat, or prevent disease. This information is for educational purposes only. As I said, I am an educator. I home educated my own children from basically preschool all the way through till college. I do have a background in education. I have a master's degree in social science education and a bachelor's in history. I taught in the classroom, public and private school. And as I said, I've also homeschooled my own children. And in recent years, I teach adults. I do a lot of health coaching and natural health classes. I've been leading homeopathy study groups for the past several years. And that's actually where I learned about colostrum. And so the two will come together in today's presentation as I explain to you this topic and what I've learned along the way. So in my family's health journey, about 20 or so years ago, I was buying a triple pack of acid reflux medication every time I went to the grocery store. And this was because I had family members who suffered from indigestion, just constant heartburn. Um, as I began realizing that we were using way too many medications, both prescription medications from the doctor for my children's allergies and over-the-counter medications, I began talking to other moms who had more experience than I did. And I learned about food as a means to health, particularly nutrient-dense food. And the book, as I mentioned, Nourishing Traditions, really changed our lives. The author of the book Nourishing Traditions, Sally Fallon, is also the founder of the organization called the Weston A. Price Foundation. This is an organization based on the principles of Weston Price, and these are the principles that are explained in the book Nourishing Traditions. And what Dr. Price did was he visited cultures all around the world and discovered that traditional cultures that ate foods the way that they had for centuries had better health than modern industrialized cultures, which were eating highly processed foods. And so changing our diet, but changing our way of life. We learned to source our food from traditional sources like local farms. Also created them. And by doing this, we were able to achieve a greater quality of health through nutrient-dense, traditionally prepared foods. Along the way, I also discovered other natural health modalities. So I began studying and dabbling in herbalism and essential oils, and eventually found homeopathy, which is a system of natural medicine that is based on a set of principles called the law of similars. I'll talk about that here in just a moment. I was in a homeopathy study group and learning from my study group leader when I was introduced to a very nutrient dense food that I had previously been unaware of, and that is colostrum. When I discovered colostrum and the particular brand of colostrum that I use called Colostrum6 by Homeopathy, I knew this was something that just about everyone could do. So again, here's the book Nourishing Traditions and the author Sally Fallon. And in the book, we learned that industrialized food emphasizes quantity over quality. So industrially produced, highly refined foods comprise much of our modern diets, especially in first world countries. And these are the main cause of chronic disease. We must return to the nutrient-dense, traditionally prepared foods that nourished our ancestors. Traditional diets maximize nutrients. Foods such as bone broth, meat, raised properly on grass and not in confinement feedlot operations, milk, eggs, and other animal products and animal fats from animals raised on pasture, along with fermented grains, organically produced vegetables without pesticides and artificial fertilizers, and traditionally prepared beverages are foods that nourished our ancestors for many, many, many generations, going back to the beginning of time. Modern diets minimize nutrients. Processed vegetable oils, seed oils, animals raised in confinement, synthetic vitamins, all of these are added to our foods along with other additives and preservatives. And the purpose of these processes are to increase the shelf life of food, not to increase its nutritional value. So by reading the book Nourishing Traditions, I was able to learn a better way of preparing food for my family. Again, I want to commend to you the Weston Price Foundation, and you can go to their website, Weston Price Foundation. Just do a Google search. I'm pretty sure it's something like WAPF.com. And you'll learn about nutrient-dense foods as a means to health. You can sign up for their email list, and you'll actually receive information right in your inbox, in your email. So here's my timeline. Again, I said over 20 years ago or so, I moved away from medications and conventional, highly processed foods and learned about nutrient-dense foods as a means to health for my family. I studied other natural modalities, and along the way, when my grandchildren came along, actually, I covered homeopathy as a separate system of medicine. It was from people that I highly respected in the homeopathy community, in particular, my study group leader, Paola Brown, that I learned about colostrum and the company Homeopathy, which produces the world's best colostrum. And I'll explain why that is in just a bit. And incorporated colostrum into my family's wellness plan. I've been leading study groups since 2020, and now I'm actually an associate with the company Innovate, and I'm helping others achieve better health through natural health coaching with homeopathy and nutrient-dense foods. And that's kind of my mission here today, with the focus on dental health. So I often say that I almost can't talk about one without the other, because I believe that homeopathy is intelligent medicine and colostrum is intelligent nutrition. What I mean by that is not that smart people use these products. What I mean is that there's an innate intelligence in these by design, I believe by our creator, that speaks to our body. And what I've learned is the body wants to heal. True health does not come from needles or pills or chemical drugs that suppress the body's ability to heal. We have an innate ability to heal. And many of these artificial means to health turn off the body's ability to heal, and they stop symptoms, but they really don't get to the root cause of what caused the problems in the first place. Homeopathy is different. Homeopathy assists the body's natural ability to heal by working with the body's innate immune response. And colostrum, which is a food, also assists the body's naturally ability to heal by giving it the nutrition that it needs so that it can do what it's trying to do and move toward balance. So I'm going to cover just a few quick fundamentals about homeopathy so that we're talking about it's always important to define your terms. And I know that years ago, when I heard the word homeopathy, I thought that homeopathy meant anything natural. I thought it was synonymous with the word holistic or even home remedies. But what I learned is homeopathy is actually a separate system of medicine. It is derived from two Greek words, homeos, which means similar, and pathos, which means suffering or disease. So when you use the word homeopathy, you're talking about a system of medicine based on a system of principles, which is called the law of similars, or like heals like. So we're using substances that might cause symptoms in a person who's well to actually stimulate an immune response in a person who's not well and move toward balance. So one good example would be the homeopathic remedy Allium cepa, which is made from onion. And we would use the remedy Allium cepa to help anyone who's suffering from those symptoms that might be caused by an onion. So we're talking about watery, burning eyes, runny nose, and sometimes sneezing. So here's a picture of an onion, and you know that if you were to chop an onion and maybe chop a lot of onion or even take a bite out of a raw onion, your eyes would water and likely your nose would run. It might make you thirsty and even anxious. And in homeopathy, the original substance from the onion is actually diluted and shaken vigorously. We call that succussion. And it's done in a pharmacological way so that it becomes curative in its homeopathic form. And so with the law of similars, we understand that any substance that causes symptoms in a healthy person can cure those very symptoms in a sick person when taken in its homeopathic, highly diluted form. So getting back to our example of the onion, the Latin word for onion is Allium cepa, and all homeopathic medicines go by their Latin name. So we would use the medicine Allium cepa for somebody who's displaying symptoms such as sore, raw, runny nose, stinging eyes, tearing, any illness that affects the mucous membrane, such as colds, flu, hay fever, and allergies. So this is just an example of the principle of the law of similars so that we understand what we're talking about when we refer to homeopathic medicines or homeopathic remedies. Homeopathic remedies or homeopathic changeably United States, homeopathic medicines are under the Food, Drug, and Cosmetic Act as a drug, and so they are considered medicines. But in the natural community, we often use the term remedy to distinguish it from a chemical drug. So just do know that when I say the word homeopathic medicine or homeopathic drug, I'm talking about a natural system of medicine, and we can interchange the term remedy with that. So how to administer a homeopathic remedy or medicine. Quantity is not as important as frequency in homeopathy. Typically, we use 1 to 4 pills, and that equals a dose, but it doesn't actually matter how many of the pills that we use because frequency is what is most important. And frequency of dosing, meaning how often we take it over a period of time, is based on the severity of symptoms. So in classical homeopathy, if something is a very severe presentation of symptoms, we would take the medicine or the remedy more frequently. If you're using a protocol, and I will be sharing a few homeopathic protocols today, it's like a formula or a recipe that's been developed by a master homeopath. And in that case, you should follow the frequency of dosing based on the protocol. And you can use, again, 1 to 4 pilules to equal the dose, but do follow the frequency of the protocol when you're following a protocol. And as you'll see in the protocol, we always stop when the symptoms improve. Other good practices with homeopathy are it's better not to let the little pilules touch your hands. So often we'll just tap it into the cap and then toss it into our mouth. The medicine is not on the pill. I'm sorry, it's not in the pill, it's on the pill. The original homeopathic medicine is usually sprayed onto the pilule. And so as long as the outside of the pill touches your mouth or your mucous membrane, the remedy information has gone into the body. Again, best practice is to put it into your mouth when your mouth is clean. So wait 15 minutes before, after brushing your teeth, or take it before brushing your teeth and before or after food. So these are just a few guidelines. With dental health, we often use one of the subcategories of homeopathy called the cell salts. They are a subset of the larger repertory of homeopathic, or I should say, materia medica of homeopathic medicines. So in the materia medica, we would see the list of medicines number in the thousands. And the cell salts are primarily just a small subcategory of homeopathy. And they are important because they are what our bodies are made up of. It's what our cells are comprised of. And often we can use the cell salts to help with deficiencies in our bodies. So when we're talking about dental health, it often is derived from a nutritional deficiency. And so cell salts are a really good way to help make up for those shortcomings in our bodies. Cell salts come in various potencies. They are used primarily in low potencies. Some examples would be 3x, 6x, or 12x potencies. 6x are most commonly found in the United States. And some of the cell salts that are going to be recommended today for dental health are silica, calc fluor, and calc phos, and they're often used in a 12x for dental health, which our protocols today are based on. They use the cell salts in various potencies. So we might find them written in 3x, 6x, 30C, or 200C. Today, we'll see them in the recommended in the lower potencies, such as 3x, 6x, or 12x. They can be taken in a dry dose, such as just 1 to 4. The Survivalist course by Joette Calabrese on page 323. So I do refer you to her course for more information. I'm just going to basically touch on a few highlights for dental health, but do understand that this is an entire course that you can avail yourself of for more information. So the cell salts or homeopathic remedies that Joette Calabrese recommends for dental support are calc fluor, calc phos, and silica. But recommended way to utilize these homeopathic medicines for dental support. So the first one, calc fluor, comes from the original substance Calcarea fluorata. Think of the keynote elasticity when we think of this cell salt. The Highlands brand numbers the cell salts, and calc fluor is usually number 1. A lot of times you'll see the cell salts sold in a kit, and there'll be 12 of them. We're not going to talk about all 12 today, but we're going to talk about the number 1 cell salt, calc fluor, to help with dental health. Calc fluor promotes elasticity, growth, and stretchability. So we're talking about connective tissue in our bodies. It helps when there's too much or not enough flexibility in the body, and that can include our teeth. And it is also a great remedy to support tooth decay, cracked teeth, and receding gums. We call it the elasticity cell salt. The second cell salt or homeopathic medicine that we're going to consider for dental support is calc phos. Calc phos is short for Calcarea phosphoricum. The keynote that we can think of with calc phos is help with growth, particularly growing children. Calc phos supports our teeth. It can help balance those deteriorations in our teeth cavities, delamination, disintegration, and softening of the teeth. Calc phos aids in growth. It intensifies the actions of other cell salts, and it is often used in conjunction with many other cell salts. And as you see here on the meme, this is from Joette Calabrese's Pinterest page. She has something called Tuesday's Tips, where she suggests implementing calc phos to help with any growth issues in children, which can include growing pains, teeth and hair issues, lack of appetite, fatigue, insomnia, getting sick easily, and generally not appearing robust. And she recommends it in the low potencies, such as 6x or 3x daily until improved. The third cell salt of our 12 is cell salt number 12, silica, or the Latin word silicea. It's made from silica. It helps whenever our bodies or our cells are lacking. And so we would use silica for things such as supporting cellular strength in our skin, our hair, our nails, our teeth, which we're talking about today, and our bones. So hair, nails, teeth, and bones, any connective tissue. And we can use it to support undernourished individuals, such as children who are lacking in meeting milestones in their growth, even despite getting an adequate diet. So these 3 cell salts, calc fluor, calc phos, and silica, can be used together to help support dental health. So this is how Joette recommends using these. I took this quote actually from one of her blogs, but I've heard her say that silica can be added as well. And it can be taken in a 6x or a 12x. And she recommends taking it from 1 to 3 times daily, depending on severity, for many months. And you would stop when very much better. And this has been shown to strengthen and aid in growth and integrity in children's teeth, but it can be used for individuals at any age. And again, this information is from Joette Calabrese. You can find more from Joette. She has a lot of free information on her blog. She blogs under the name Practical Homeopathy. So do a Google search, Joette Calabrese or Practical Homeopathy. And I think you can find her at either one of those web addresses, joettecalabrese.com and practicalhomeopathy.com. I've taken many of Joette's courses, and I've led many of her study groups over the years. And so some of the protocols that I'm going to share with you today come from Joette's courses. The first one I wanted to share with you is using homeopathy to help with tooth extraction or any kind of nerve injury. And this information comes from Joette's Survivalist course. You can find it in her manual on page 330. These are going to mention some additional homeopathic remedies. And again, I refer you to her blogs and her courses for more information. But I have used quite a few of Joette's recommendations with my family, and I'll show you what we've used for my granddaughter in just a moment. But the first one I want to share is for tooth extractions or nerve injury. And Joette recommends Hypericum 30C or higher, along with Arnica montana 30C or higher, along with Magphos 6X, and that's another one of our cell salts, so I highlighted it here. And she says these make an unbeatable trio when you have to have dental work done, such as a tooth extraction. The way that she recommends in the Survivalist course that these be taken is that you would alternate these remedies every few minutes before a procedure and approximately every hour or so afterwards until shock and pain is long past. These can be used for tooth drillings and tooth extractions or cracked teeth as well, per Joette's recommendation. This protocol I'm sharing with you comes from Joette's antibiotic alternative course. She recommends the remedy Heper sulfuricum. We call it Heper Sulf for short. She recommends it in a 6C, and this can be taken twice daily until better for any gum infection, gum boil, or dental abscess. And I'm going to show you how we incorporated Joette's recommendations for my granddaughter. So this is the case of a 6-year-old child, and she was 6 at the time. She had an abscessed tooth, and we looked at Joette's courses and put together this schedule of remedies for her. And what we saw was that for the abscess that she had, it resolved the issue. So this comes from Joette's antibiotic alternative course. And I went ahead and studied up on what she recommended for dental infection and dental abscess, and also what she recommended for cavitation with soft tissue infection. I gave the recommendations to my daughter, and my daughter actually ended up using all 3 of these in an alternating fashion, and it resolved the issue as I mentioned. So here's the protocol. Hypericum 200 mixed with Arsenicum album 200. These are taken together, and they're taken twice daily. Stop when very much better. My daughter also added Heper Sulf. That's the one we've already discussed, Heper sulfuricum. And this she took in a 6C twice daily, and again, stopped when better. And then finally, the last part of the schedule that she went ahead and implemented was adding Pyrogenium 200. And that's because Joette's recommendation for cavitation with any soft tissue infection, she recommends the Heper Sulf in a 6X or 6C, along with Pyrogenium 200C every 3 hours until very much better. So again, my daughter used the Hypericum mixed with Arsenicum, the Heper Sulf, and then added the Pyrogenium. And these were taken in an alternating fashion. And what we saw was that my granddaughter's dental abscess resolved over the course of a couple of days, 2 to 3 days, and she did not need to use antibiotics. And I'm not making any recommendation for you. Please do seek the advice of your doctor or your healthcare professional. And I do refer you to Joette Calabrese for more information on her protocols. I'll just mention here that Joette studied under the Banerjee doctors in Italy, and so her recommendations are primarily taken from the doctors Banerjee, who are master homeopaths who put together these protocols. They're referred to as the Banerjee protocols. I also would encourage you to seek out a professional homeopath whenever the situation is a serious acute condition or a chronic health issue, and it's outside of your scope of expertise. Do seek the help of a professional. And I do want to give you some resources so that you can know where to look to get more information. So you can find the help of a professional homeopath at homeopathyhelpnow.com, or homeopathy247.com. And I have used Homeopathy Help Now in the past for family members during complex acute situations, and I do recommend them. I've also worked with Melissa Crenshaw for acute situations, and so I did want to mention her. She is a homeopath that I highly recommend. I've also studied under her and taken her courses and her mentorship program. You can find Melissa at melissacrenshaw.com, and she does a free 15-minute consultation, and she has affordable pricing. So I do recommend her. I also recommend Amber Fox. I have worked with Amber for chronic situations for myself and for family members. Her website is allthingshomeopathy.com, and that's where you can find her. She has custom remedies, so you can shop there and purchase remedies from her. She does acute and chronic consultations. She has courses, so she has much in terms of education. She also does something called bioresonance scanning, and that is a technology that's used along with homeopathy that I have used for myself and my family, and she has various family plans. So I do want to refer you to Amber if you'd like the help of a professional homeopath for chronic consultations. And then finally, I have not worked with Rachna Kapoor, but I do know Rachna very well, and I know that she is a medical doctor. She was actually featured in the movie recently, Introducing Homeopathy. So if you've seen that movie, you may be familiar with Rachna and her story. But she's a medical doctor who was disappointed in her own profession when it came to her own health, and she ended up becoming a certified homeopath. So now she uses homeopathy in her practice as well. And you can find Rachna at drrachnakapoor.com, and I refer you to her for, again, more information. So as I said, nutrient-dense foods was the gateway to natural health that I learned about. And then along the way, but then it was from the homeopathy community that I learned about colostrum as really nature's most perfect nutrient-dense food. And it has been a game changer when it comes to dental health in my family. I learned years ago that Hippocrates, the father of modern medicine, said, "Let food be thy medicine and thy medicine thy food." And so food is really an important component when it comes to health. Think about it. Bad fuel versus nutrient-rich fuel. If you were just for a moment to think of the human body as a car, like a car, our bodies are made up of separate but connected systems. Just like an automobile thrives on the appropriate fuel, our bodies thrive on nutrient-rich fuel. So if we're giving our bodies substandard nutrition, we will have substandard health. What I learned about colostrum is that colostrum is food. And not only is it food, but it is really nature's first food. It's the most nutrient-dense food on earth. So raw bovine colostrum is a traditional nutrient-dense healing food. And I mentioned the Weston A. Price Foundation as being one of the first places that I started looking at for information on nutrient-dense foods. And once I discovered colostrum, I went back to find out, what did the Weston A. Price Foundation say about colostrum? And I was pleasantly surprised to find that they did endorse colostrum, and I had missed it. So the Weston A. Price Foundation endorses raw bovine colostrum as a traditional healing food that has been historically used in cultures around the world. Do note that colostrum is not milk, but the first fluid produced by all mammalian mothers prior to the production of actual milk. Colostrum supports gut health, dental health, and the entire immune system. Here in this picture, you'll see my milk from my local farmer with the cream line still intact, and this is raw, unpasteurized milk. You see a jar with a cotton cloth over the top, and that's my fermenting kefir that I have always on the counter, naturally fermenting kefir and yogurt because they are traditional nutrient-dense foods. And then my Colostrum6 and Novate colostrum, which I began incorporating to our diet once I had discovered it. So now let's talk about colostrum. Life begins with colostrum. Colostrum contains the building blocks of life. It jumpstarts over 40 different processes in a newborn, and it's baby's first perfect meal outside. It's truly nature's first food. Cows are the universal donors of colostrum. Bovine or cow colostrum is 99% bioidentical to human colostrum. Colostrum from cows is 100 to 1,000 times more powerful than human colostrum. Bovine colostrum in form, composition, and function to human colostrum, but more powerful. The immune and growth factors in cow colostrum have been verified in lab analysis to be identical in molecular structure to humans. I love this quote by Dr. Bernard Jensen. He says, "The great advantage of colostrum is that it is a food, not a drug. Colostrum was designed by nature to be gentle enough for baby animals to take, yet strong enough to protect them from a number of very dangerous diseases. So colostrum is the ultimate in nutritional excellence." Dr. Bernard also says in his book, Life's First Food, that low energy food produces low energy people, people without the power to prosper, avoid disease, or even survive. So again, colostrum is the most nutrient-rich natural substance known to science. It is a food produced by all mammalian mothers, and it is more powerful than human colostrum when you gather it in the first 6 hours after birth. It's really important that it is harvested from the mother cow during the first few hours following birth, because after that it becomes transitional milk. And it is different from colostrum if you're using a product that's gathered anytime after the first 6 hours. So do make note of that. Inovate's colostrum is the best on the market because it is the only colostrum that has been third-party verified to be pure and obtained within the first 6 hours of colostrum. I'm sorry, of production. So this is the founder and formulator of Innovate, and he is the world's expert on colostrum. He's written 2 books. The first one I mentioned at the beginning of our presentation today, and that is The First Milk Diet. He's also written another book called Your Vitality Factor, The Secret to Living a Long and Vibrant Life. I've been able to meet Dr. Kleinsmith, we affectionately call him Dr. K, in person at the Innovate conference. I've actually been able to attend the last few years each summer and learn and sit, been able to learn from him and sit under his teaching directly. He recommends that we go to pubmed.gov and search for any condition that we might be concerned about. And in the search engine, put the words bovine colostrum and the condition. And the reason that's important to do is because colostrum is a food, it is regulated under the food side of the Food, Drug, and Cosmetic Act. And we're not allowed to make any claims about foods when it comes to health. We can't diagnose, we can't claim to treat or cure any condition. So you have to do your own research. But I'm going to do a little research for you, or share a little bit of my research and some of the information that I found by doing just that. And so I put in the keywords bovine colostrum and dental health, and came up with some really great studies that support the benefits of colostrum for dental health. So here I'm going to just share 3 with you real quick. This one was titled "The Use of Bovine Colostrum in Periapical Defects Following Surgical Endodontics." 2 case reports. You can find this at ncbi.nlm.nih.gov. And this study came to the conclusion that the clinical and radiographic evidence of the present cases that were studied suggests a positive outcome of colostrum being used as a biomaterial to fill in the bony defects after periapical surgery. Colostrum can be used to bone grafts and is also economical and easily available with favorable outcomes. So again, I submit that to you for your consideration. Again, not making any claims, but just pointing out to you that this is an interesting article. Here's another one. Bone regeneration in vertical osseous defects in periodontitis patients using bovine colostrum. And you see the web address here. The conclusion, based on the clinical and radiological findings of 3 cases included in the present case series, there is a preliminary evidence to suggest that colostrum-based treatment of bone deficiency following periodontal surgery had a beneficial effect. And the third study that I want to share with you is titled Oral Findings in Patients with Primary Sjogren's Syndrome and Oral Lichen Planus, a preliminary study on the effects of bovine colostrum containing oral hygiene products. And there's the address. And the conclusion, bovine colostrum is rich in antimicrobial substances and growth factors. The purpose of this open study was to examine and compare the interventory effects of daily use of bovine colostrum containing oral hygiene products on oral symptoms and findings in 20 patients with primary Sjogren's syndrome and 20 age-matched patients with oral lichen planus. In both patient groups, unstimulated whole saliva flow rate had increased and periodontic pocket depth were reduced, and general health and oral dryness and soreness had improved after using these colostrum-containing oral hygiene products. A decrease in hyphae was found in Candida and a blastospores and OLP smears. A reduction in the extension of the mucosal lesions was observed in 15 oral hygiene products, again, using the colostrum-containing oral hygiene products. Results suggested beneficial effects of intervention with colostrum-containing oral hygiene products on oral symptoms and general health. That's a mouthful. Again, I'm not a medical professional. I just submit this research to you for your consideration and want to show you that there's a lot of science out there to support colostrum for dental health. This comes from Dr. Kleinsmith's First Milk Diet book from pages 12 through 13. He says, for humans, colostrum is a health bonus. Humans do not require colostrum to survive. In most mammals, biologically active substances are transferred across the placenta. Cows are different. Very few of the biologically active substances are transferred to the calf before birth. Bovine colostrum contains more biologically active substances than any other species. Same as human, but higher concentration. Research has shown that colostrum supplementation increases energy, stimulates tissue repair, kills bacteria and viruses, and optimizes cellular reproduction. And that's from page 8 in the First Milk Diet. So here's a picture of my daughter and her beautiful smile. And one of the things that I learned from my study group leader when I was studying homeopathy was that although homeopathy does much to support dental health, sometimes it's not enough. And it was my study group leader that had posted in our Facebook group, Colostrum for the win. And I took mental note at that time because I thought, wow, I thought homeopathy was the last piece of the puzzle that I was looking for. Turns out it was a very important piece of the puzzle, but there was always more to learn. And so I made a mental note to remember colostrum. And it was when my husband had a filling fallout that he had had since childhood, and he had mentioned that perhaps we needed to schedule a dental appointment, that I went ahead and ordered my first 2-pound container of colostrum. I had him pack the colostrum powder around the area that was sensitive. And within weeks, he had reported back to me that the sensitivity was gone. And we never did make that medical appointment because it wasn't necessary any longer. My daughter also had been complaining of dental sensitivity. She began packing the colostrum powder around her teeth, and she discovered that the sensitivity resolved. And I learned this method for helping dental issues from Dr. Kleinsmith himself. You can take colostrum orally in capsules. We have chewable lozenges, and also in the powder form that can be mixed with food or liquid, hot or cold. But the best way, he told me, for colostrum to support your teeth is to pack colostrum powder in your gums before you go to sleep. And you would pack it on the outside of your gums, in between your cheek and your gum, but also around the tooth or any area that might be sensitive. And this would be done after brushing your teeth, but just before going to bed. Then the colostrum powder will dissolve in the mouth overnight, and it goes directly into the body through the mucous membrane. And this was very effective for my family members. Some people have trouble with that sensation. So the next best option would be to get some in your mouth and let it dissolve slowly. Okay, here are some of the things that are in True Colostrum, and I mentioned that you do want a 6-hour colostrum. True Colostrum contains immune helpers and tissue repair helpers. I won't name all of them by name, but just want you to be aware. True Colostrum also contains metabolic factors. So there's over 700 nutrients that have been identified in True Colostrum. The Weston A. Price organization recommends mixing colostrum with your yogurt or your kefir, and they actually have an article about some of the benefits of that. And I do refer you to an article called Shifting the Medical Paradigm with GC, MAF, and Raw Milk. Again, I'm not making any medical claims, but this was an article that I found interesting. And so I've been incorporating the colostrum in our yogurt and kefir, and I've actually started making my own yogurt using colostrum, and I'll share a recipe with you here. So magic yogurt can be made in small or large batches, but I've kind of landed on this large batch recipe. And you can email me for the recipe and I'll be happy to share it with you. So the recipe uses unpasteurized milk, organic yogurt from a previous batch, or you can buy it from the store, colostrum powder, and a probiotic. And I use Homeopathy's probiotic GB6, which is a top shelf probiotic. I whisk all of the ingredients together in a large crock pot. I heat it on a high setting until the milk is warm, and then unplug the crock pot, turn it off, and wrap it in a large beach towel to insulate, and leave it on the counter for 12 to 24 hours until the yogurt is set. Then sometimes there's more whey and sometimes there's less, just depends on the batch. But if there's a lot of whey, I will strain off the extra whey and spoon the thickened yogurt into mason jars. And then once I've done that, you just store it in the refrigerator and it lasts for weeks, probably even months, but usually we go through it in a number of weeks. And it is very tasty, and I call it supercharged or magic yogurt because it does have those extra components. And I did get the recipe initially from the article Shifting the Medical Paradigm with GC MAF and raw milk. And again, I used my own formulation to make it into a large batch recipe. Homeopathy is the gold standard in colostrum, and all of its products are the highest in quality, the best that money can buy. And they do have the best price because they manufacture everything themselves and there is no middleman. And they use direct marketing to advertise. And so it really is an economical product and has the highest quality at the best value. What to look for in your colostrum, and just to give you a hint, Homeopathy's colostrum does meet all these criteria. You want to make sure that you purchase raw colostrum, that it's in its whole form and unadulterated, that the directions say that it's safe for all ages, that it's gathered during the first 6 hours, and preferably that's going to be third-party verified, that it says that it has over 700 plus nutrients, and that would be indicative that it has all the nutrients as whole colostrum. Some products brag about having 200 or 300, but anything less than 700 indicates that the colostrum has been fractionated or adulterated. Make sure that it's full fat colostrum. You may need a frother to froth it into liquid because of that reason, because fat doesn't easily mix. If it mixes in easily, then that means it's been standardized. And so that's not good. You want it to be a single ingredient with nothing added. So if you see any other additives such as sunflower lecithin, bioidentical liposomal lipids, et cetera, that's not good. And again, gathered within the first 6 hours, and preferably from multiple herds that increase the diversity of components. And that would be a Novote's methodology for gathering their colostrum. Their colostrum is from hundreds of herds in the United States that are raised on grass, chemical-free, antibiotic-free. And that way we get all the antibodies from these herds in our colostrum. If you'd like my recipe for magic yogurt, or if you'd like more information, please do reach out. If you have any questions for further information, you can email me at hello@motheringstrength.com. If someone else shared this video with you, do get back to them. If you're interested in ordering colostrum, we can give you an ordering link that can help you get the product at the same wholesale prices that we get as a Novote Associates. Sharing is caring. So thank you for joining us today. I'm going to go ahead and stop the recording. And for those who are here live, we'll take any questions or comments at this time. Thanks, everyone.